This is episode 151, What the Feck of SLP's Wine and Cheese podcast, featuring Julie Fechter, and you might know her better as Julie.365.weekend on Instagram, or the Facebook admin of the group khunt. So, with that being said, in this episode, we get a little explicit. And no, I did not hit the explicit button on this episode. So if you don't like explicit chat, maybe, I don't know, scroll ahead or scroll back because this is the most recent episode, or skip this episode, but you don't want to because it's really good. All right.
Hello, everyone, and welcome to another episode of SLP's Wine and Cheese. I'm Deb, and today I am joined by Julie Fechter. Hey, Julie.
Hey.
You might know Julie better as Julie.365.weekend, or the awesome admin of the Facebook group khunt. How you doing today, Julie?
I am doing okay. How are you?
I'm wonderful. I love the weekends. I love just spending time with my little kid. He's so fun. He's getting big.
Little Benny.
Yeah, he's just so wonderful. And it's like you see them getting bigger and you're like, I don't have a baby. But then they're doing all these cool stuff and you're like, you're amazing. So it's like a lot. I don't know how to describe it. But yeah, so I'm doing well. I just got my son down to a nap, and before that we rode his scooter all over Red Hook. We went to the bakery and the wine shop where I got this nifty Sauvignon Blanc from Daniel Brennan. It's a wine of New Zealand. It's a 2019. It's from where did I say it was from? It was the
North Island, New Zealand.
Yes, thank you. Warm climate. And
maybe it's from Marlborough.
Oh, thank you.
Maybe.
It's good. It's a dry wine. It comes in a can. I probably should pour it in a cup, but I don't have time for that nonsense. So I'm gonna vote drink it. It's very good. Julie, what do you have?
We are drinking a little bit of water with maybe a little vodka, but I do have brunch to go to, and I can't pregame because I am a sloppy drunk.
Is vodka water like your drink though, or you're just doing that right now? Like vodka soda was my drink. That was like, I was getting down to business when I went out.
I usually do vodka soda, but I don't know. I don't have anything in my house.
Mm-hmm. Okay. Yeah. No, I know people who do like vodka water. Like, I don't know how, but I know people who like drink that as their drink. So Julie, tell us. So Julie is, like I mentioned, she's an SLP. She works with adults. Tell us a little bit about your background.
Okay. Well, I mainly was in SNFs. And I went to grad school at the University of Utah. My undergrad is from Brigham Young University, but we don't have to go into that ever, really. And I came out and I live in Seattle, and I worked in SNFs for 6.5 years. And then I quit and ran away for 1.5 years to travel. That's where that Instagram handle came from. And when I came back, I got put into, I didn't get put into, I worked there in some really terrible SNFs. And it really ruined my heart to try to see these patients who are usually low socioeconomic status. And I'm being asked to basically commit fraud constantly to make the people money. So I started working inpatient rehab. I also got a job at a hospital right before COVID. I don't want to talk about that. My dream job. And then now I mostly do home health, and I love it because you're really meeting patients where they're at. And if they don't want to do what you say, you have to find a way. Ooh, I rhymed. Ooh, I'll rap later. No.
Please rap later.
I can sing. I can't rap. You have to find a way to, obviously use a little motivational interviewing to help them want to implement some of your strategies, But also, if they don't want to thicken liquids, they're going to do whatever the hell they want. And so a lot of what I do is, well, you're going to do that no matter what. No judgment. I'm here for you to help you figure out how to stay as healthy as possible.
Yeah,
So,
I love that. I mean, I feel like I take that approach with anything. Like when people tell me crazy stuff, I'm just like, I'm not going to change you. So like, I'm happy you're being honest with me because now I just have like the best available information. Um, but yeah, I feel like anyone can tell me anything horrible and I'll be like, got it. Okay, so here's the next step. Like, because it's like, that's just true. What do you want?
well, and working in healthcare, I mean, we're their partners. We're not telling them what to do. And if you're sitting here and judging them, I mean, are they going to ever really make that connection with you? I actually just had a patient tell me when they got a certain diagnosis, they didn't like that doctor. So they left and never went into what that diagnosis entailed. And it's a degenerative condition that is probably one of the worst. And they were like, and I just didn't like my provider. And who knows? And I didn't want to get into why, even though I was very curious, but like, it maybe if you're judgy or if you don't have a good bedside manner, or if you just, just aren't a nice person, I don't know. It's people aren't going to be that team with you. It's going to be like, I'm telling you what to do. And they're going to say, well, I don't want to. And that's their right. But I feel like we have to be not better people, but we have to be really engaging and lovely to make our patients want to make these changes.
Oh, we definitely have to be engaging and loving. Lovely. Lovely is what I meant to say. I feel like that should be the quote. Just be engaging and lovely.
It could be loving too.
No, but I think lovely is better because I think the closer I resemble a Disney princess, the better children respond to me. So a Disney princesses, despite all like the misogyny and things that are wrong with Disney, they're quite lovely. Other than that, just animals flock to them. They go ha 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 ha. Birds land on their hands. So yeah, just like be lovely.
Well, and for me, being lovely is being their friend. And so I do frequently have to tell my patients, I know that we have such a good relationship and I'm here to help you. I was like, but you do have to remember, I am not your friend. I was like, I do love working with you. And I'm so happy that we have this good relationship. But I was like, I am here on a professional basis, even though I like to go off on little things, but I do have to really be like, I sometimes have to really make that thing. Cause they're like, well, you're my friend. And I'm like, on one side, yes. On the other, no.
Yeah. I mean, I feel like some people might think, oh, my ideal position is staying in one location all day, whether that be a school, a hospital, a clinic, and seeing patients come to you in and out all day. And then some people do that and then they realize like, oh, I'm trapped in this place all day. It's like really hard and exhausting. And then you might actually like the home health where you travel and visit and you go back outside, you like get breaks in between. I have found that for myself that I actually like on the days where I do spend my whole day in one location, it's kind of difficult for me. I like when it's like, okay, I get to escape now. But my issue for a long time was getting out of that house. Because also you have to think like I'm going to see kids and there are some moms who are just there all day and they didn't have any adult and they just have been picking up toys and laundry and food and watching, I don't even know what's on TV. So it's like, it's hard for them. They're like, you are like, if you're not my friend, then who is?
We've touched on like COVID loneliness with seniors. Like sometimes I will tell you, I am literally the highlight of 90% of my patients' day. And that's also because I'm super lovely again, but
being lovely.
And I recently was told that I make education fun. And I was really proud of that because I do want someone to listen and take in what I'm saying. But I am fun to be around. And so for me, yes, also the seniors, they're so lonely and they're going through the hardest times of their lives. Sometimes I just hold their hand because I know no one else is going to that day.
Right. That was my hardest thing about working in the SNFs. I used to always sneak looking in there. Is it still a big book? Is it still like their file is like actually like written book in the nursing homes? Do you know?
I
I would
haven't.
always check like the social workers pages to see like who visited, how often and stuff. Because I would just feel bad if nobody was going to say hi to them a lot. That's another reason I feel like I keep going on tangents, but another reason why when people talk about imposter syndrome, and I'm not going to get into this, I'm not really, but one thing I do want to say is just like, you're going to visit people and sometimes you just have to hold their hands or you're the only one who talked to them that day. Like, how are you an imposter? You're being a human, you know?
But
And
sometimes why will just coming from the sniff perspective, but we do want to not get into this, even though I know you do. You're being what we want to do is we can't because of Medicare or because of money
right.
or because of the desire to do fraud or because of
Sources. Yeah.
so it's like then sometimes if that's what you're doing, you're holding someone's hand, you're like, well, I'm not here to do this. So I can no,
Yeah, I hear that. So like sometimes if you don't go in there holding their hands, you're not going to get them to hold a spoon or a fork or anything like that. Sometimes you have to start that way. But anywho, today we're going to talk about how thicken liquids. We're going to also consider other body systems and taking a team approach when making your recommendations. Isn't that right, Julie?
That is. And before we even begin, I do want to give a shout out to someone who has a course on this. I'm not paid to do this. I just went to her ASHA talk, but also full disclosure, she's my friend and one of my dysphagia mentors. And Brooke Richardson has a course about this right now, and she's going to revamp it. It's like the hip bone's connected to the hyoid bone. And so if you want something super in-depth from someone who is, I did tell her, I texted her last night and said, I feel like your humor is not always like appreciated because she's really, really fucking funny.
I better follow her on Instagram.
Anyway, she has a course. And again, I'm not being paid to do this, really not. But she had this really good course at ASHA, and that was only just the beginning. And apparently she's gonna have a really good one, but it's all about considering the other body systems. For example, I've also worked in an acute hospital. I said that already. And you would see people come in from sniffs with UTIs that turned into sepsis, and they were on thicken liquids. And I, of course, would be like, well, we're getting them fucking off these thicken liquids because what are we doing?
Right.
And we can't ever say, did we cause the UTI? But for me, that's something I think about. And especially because UTIs then turn into sepsis.
So do thicken liquids, are they less hydrating, or do you think it's a less frequency of consumption that results in dehydration, which in turn turns to the UTI?
I'm not 100% sure. I would have to look at research on that, but also I don't even know if there is a lot of research about it. I know there is an SLP, and I don't want to name her because I don't know, but she is going to start her PhD sometime soon, and she wants to do it all on thicken liquids. Shout out to her. I'm not going to name her just because you don't know, right? But I think that could provide a lot of information for the future and just how we can consider, because what happened, Julie is a doom and gloom. Let's help prevent that, right? So what I say to I don't say this to my patients, but I think about it. I'm like, because I talk about hydration all the time. Hydration is super important. Older folks don't hold as much water in their bodies. I found that out within the last year or two. So they technically might need more because their bodies don't have as much, right? And then so let's say you don't drink enough, you get a UTI, which makes you confused. And then there's other directions. They're going to fall and hit their head and have a stroke and die, or they can get sepsis and you have to go to the hospital.
By doom and gloom.
Yes. I just like to think about the worst case scenarios, and how we can help prevent that is by staying hydrated. And I don't know if I have met anybody, no, maybe one patient who liked thicken liquids over thins. And usually they just look at it, and especially like in facilities.
I had one in a facility, but it was out of fear.
And who put that fear into them? Or was it just a fear?
They seemed scared. They were like, oh, no, it's not thick enough. I'm going to choke on that. I'm going to cough. So I don't know, maybe somebody else, either a caregiver or the other SLP or a doctor. But they seemed personally scared. I mean, there's a difference between warning someone and they're like, I don't care. Like, tell me I can't have all of this cheese in my soup. Like, it's gonna be too much salt. Like, I'm like, okay, I get it, salt is bad. But I don't care. I'm gonna eat any cookie that I want, or I'm gonna, alcohol is poison. I have a wine podcast. Like, so I don't know, honestly, but it seemed like, this person had a bad experience, and then they were then frightened, like a picky eater.
Well, and I have had those patients as well. Excuse me, I'm hiccuping. Who they don't enjoy coughing, and it's not. And I do have to. Sometimes I do try and explain. 'Cause I'm like, well, with liquids, it's not necessarily that you're choking, right? It's not really stopping you from breathing. It's uncomfortable and things like that. So if you would like thicken liquids so that doesn't happen, I'm here for it. And a lot of times in those situations, it's like, well, let's find naturally thickened liquids for you. Like, let's do some smoothies. Do you like tomato juice? Probably low sodium, or like some nectars, things like that.
Yeah,
but
I haven't even thought of that.
That is something that I've tried with people who they don't swallow great with thins, because thickened liquids can be more silently aspirated. And I mean, let's be honest, we have like systemic issues that lead to not be able to get a swallow steady really quickly. And if I'm going to recommend thickened liquids at bedside, I mean, I can cause more harm than good. Right. So I don't know. And this was going to be our quote, but we changed the mind. But like, I don't always know what to do. And I feel like that's why it's clinical practice, because everybody is going to react differently. Everyone's bodies are different. But there are some general things that you should not do. I do generally know what not to do.
And what are there any general things that you could say what not to do? Like for me, I know, like I don't do hand over hand. I just don't, like, maybe, but that doesn't mean never. Like I might take a kid's hand together once or twice to be like, this is what it feels like when your two fingers touch each other. But that's it. Like, it's not every time. It might have been like the first or second time. And then moving forward, I'll just model it. I might give like a tactile like tap to show. But yeah, like I don't force anybody to do anything. I just know that's wrong. And I also feel like another thing that's wrong is like using negative emotion when you're frustrated or upset. I just work really hard to remain neutral. Like, no, we're not going to do that. Here's what we're doing next. So like, those are like things like I just know, like if I don't know what to do, like if somebody is just like not participating, I just know only thing I can do is control my own actions. So I can change my voice, I could change my face, I could change my emotions, and that's all I can do.
Well, and for me, it's not even about, because that's a little like, I'm thinking more clinically. So the one thing that I would say is having like a blanket diet recommendation, and everyone I see needs puree and honey. And to me, I've seen multiple people do that. And to me, you should never have a go-to diet for, if like my diets, every single person is generally individualized. This one person might want a little applesauce with their meal to help with, getting food out of their mouth because they have a dry mouth. Another person might just benefit from gravy on top because they prefer gravy. They don't like applesauce. And the closest thing I get to making a blanket recommendation would be if there's like an alcoholic going through withdrawal in the hospital, like a puree and thin is generally something when someone's like super out of it. That's like the closest I would ever get. But I have seen quite a few speech pathologists do a blanket puree and honey.
Oh no. I mean, I think that for me, I like mechanical thaw. For me. Every time I saw that tray, I'm like, that's already chopped up quite nice the way I like. That's like a taco. That's like shredded chicken. That's like how I take all my food. So if anyone wanted to make a blanket diet for me, I would go mechanical soft. Thank you. I mean, it's the worst name, but
I will say for me, and we can go into IDSI, but minced and moist, not for me. Level 5, that not for me currently, but like I think that could be a perfect diet texture. I know that sounds silly, but like meatloaf, pasta, squishy things. Like you can cook food. Sorry, I love to cook. You could cook food in the slow cooker, and that stuff would basically be a minced and moist. So, but in
minced and moist, like mechanical soft. I've never written minced and moist. It sounds like dog food.
That's new. It's the IDSI. It's level 5, minced and moist. It's like dysphagia mechanically altered, or there's a dysphagia mechanical soft. There's lots of names for it.
Yeah. But, oh yeah. So I think we're saying the same thing. Like that's how I want my husband to give me my.
Well, no, because that you're a level up. You're talking about more of like a level 6.
Oh, okay.
But level 5, like mac and cheese could be a level 5. Heck yeah.
Right. So it's like cooked a little bit extra though. Because I like an al dente noodle though. I don't.
Now you'd need cook it a little more.
Okay.
But yeah, I think if you walk into a room or home or whatever, and your first instinct is no matter what diagnosis you have, no matter what's going on, we're giving you puree and honey. That is 100% the biggest no I think I know.
Yeah, but I feel like in grad school, that's what I was taught as a safety net. I feel like that's what I walked away thinking, like if everyone's consuming this, they are at a decreased likelihood of aspirating, which and then would automatically turn into aspiration pneumonia, which would automatically kill them and it would be my fault, which is completely unreasonable and not true.
Yep. And the thing is that we need to learn. And then what is it? Know better, do better. Right. And yeah, because like even honey thick, that we'll get to that quote at the end, which I love, but honey thick can cause more problems than it solves in a lot of folks. And my BFF at her hospital, correct me if I'm wrong, friend, they don't even have honey as an option.
Oh.
I'll like text her after, but
I mean, you might have spent like a month in school just being like, if it drips off of the spoon like this, you've got the right texture. And that was all like $15,000 worth of nonsense.
Well, and I only had one dysphagia class in grad school, and it was from our voice professor, and he's wonderful at voice. And I mean, I'm obviously not going to talk shit on my grad program on a podcast, 2 SLPs, but he was the voice professor. He wasn't necessarily a dysphagia specialist. And I think it's a really big shame that we don't get a fuck ton more education on dysphagia when that's like 75% of my caseload, up to 90 sometimes.
Well, my dysphagia teacher was a dysphagia specialist, and somebody said that all her notes came from Wikipedia. And I was like, no. And then I looked at Wikipedia and it was exactly the same. But it also is like, that is what dysphagia is. So I was like, I don't even know what to think here. And I don't know. But yeah. I liked her. But
sometimes being liked isn't 100%. Like, I mean, I like liking people. I like being liked. Not pathologically, but I mean, it's easy to like me or it's easy to hate me. I'm very polarizing, but like, I don't
like me or hate me. That's it.
One, like, I don't want to just like my professor. I would like a little more about that. Well, I mean, I am just going to say this and then we'll move on. We definitely did like a fuck, marry, kill with our professors.
I mean, I had all women, so I wasn't going to do any of that, but I felt like she was very smart. I knew she was. I knew she was great at her job, but I don't know, like maybe the grad program just it wasn't enough resources, or she was just like, none of you want to go into the medical setting, so what am I doing here? Which I would have, but I was also dating a lunatic at the time, and that was my number one priority, to be honest. So it was also my fault. Anywho, let's
Men.
talk about let's talk about how thicken liquids and like considering other body systems.
So so again, thicken liquids, we don't necessarily know their effect. And what happens, I mean, my biggest one is just thinking about hydration. But we also don't know how it affects pretty much anything, how it can, because a lot of our folks have diabetes, let's be honest, and they have gastroparesis, a lot of them. Or our folks in their 90s can have like Presby esophagus. And so what happens when we're putting the thicken liquids in there? So I think a lot about GI. And I mean, in the end, a lot of it comes down to, I think, a lot about hydration. And then we can also think about like constipation.
Yeah.
So, I mean, I don't even want to go into how it affects the other body systems, because I really do recommend taking Brooke's course. It's really good. Well, the one I saw, because she goes into so much more, and that's more than I even want to get into today. Because my biggest one is my folks are sitting at home not drinking because they lose that desire, and then you're going to put this thick shit there, like they're not going to do it, and then they can't poop either, and then they're going to get like a bowel obstruction and going to die. No, I told you, I'm doom and gloom.
Right, yeah. But then also it's tricky though, because if they're on high blood pressure pills, like all the old people in my family end up on, not me though, I am going to avoid the salt and nothing bothers me. My heart rate stays cool as a cucumber. But who knows? But yeah, like if they're on high blood pressure stuff, they can't drink a lot.
Yes. And so then we don't know how the thicken liquids is going to affect that, or how they're going to affect digestion of the meds either. Or a lot of people have CHF, and
what's that?
Congestive heart failure. Yeah. So, or kidney issues, and they get put on liquid restrictions as well. And actually, I've been Googling managing chronic conditions because of cog therapy, and that's a whole other thing I've been doing. But there isn't a lot of research on how to manage these chronic conditions together. Because, I mean, I always tell my patients when I'm talking about dry mouth, I'm like, well, you are on quite the cocktail of meds, aren't you? And the urologist is like, well, we're going to do this. Your neurologist is like, well, we're going to do this. And then your kidney doctor, nephrologist is like, we're going to do this. And then the GI doctor does nothing. You don't know my bias against GI doctors.
Oh, I didn't know. I didn't know that. No.
My friends are very not curious, but think about how we are giving them this thing that's altering so much, and we don't necessarily know how it's going to affect all these different things.
Right. And that's how come you want to talk about taking a team approach. But it's hard. Like, even every time I try to like organize a team call with an OTPT and parent and teacher, it doesn't happen, or nobody. It's because we have too many people on our case list, which is not an excuse. It's just the reality. I don't know.
Well, and I don't remember, I don't think I talked about this time, but my job is fairly low productivity. And so I do have the time, but also I work in a hospital system. So I get to message my doctors quite frequently, and I usually get responses. And so I had an older patient who had the history of UTIs, and it might have even progressed to sepsis a time or two. And she was coughing a little on thins, but she didn't have any issues with lung stuff. I mean, obviously you could say yet, right? And I contacted the doctor, the PCP, and I was like, hey, so this is what's going on. She's coughing a little bit, but I'm also very concerned about a urinary tract infection, because, you know, it was like literally like 6 to 10 in a year, something crazy like that. And the doctor said to me, I think we should keep her on thins. Let's do that. Thank you so much. I really appreciate your careful consideration and reaching out. And so we did try and focus more on just water and brushing the good teeth, because what we're trying to balance. And we don't, as speech pathologists, I firmly believe we do not have the kind of medical training to help with those decisions at times. If you didn't seek out training after grad school and those kinds of things, you weren't taught that. Even in your externship, probably weren't taught that. In your CF, I wasn't taught that.
Mm-mm.
So a lot of times I'll involve the doctor, PCP, primary care physician. One of my other dysphagia mentors frequently contacts nephrologists, obviously, kidneys and liquid. Ooh.
Right. Yeah.
Or you could even talk to the pulmonologist, ENT, GI. So there's lots of different people you can involve.
Yeah, my boss now is good about it. She's always like, well, we should call them up. I'm like, all right, let's call them. We'll call them up. Add it to the Google Cal. All right. But yeah, now I also have a cushy job, as you described, where I can call people. But for the very longest time, no, I did not have the luxury of time and availability.
And technically, like, we can't necessarily put PHI in emails, and emails are such an easy way to be in contact with people. But what are you going to fax them? Is it 1985? Like,
yeah.
That's the year I was born. It was a very good year.
That's my sister's year too. Nice. Well, thank you so much for joining me today, Julie. I'm wondering if you have a quote to leave the listeners with.
I'm going to say, don't be a dick, avoid honey thick.
I love it. Thank you so much. Follow Julie on Instagram. She's at Julie.365.weekend. And
365.
365, right? Because that's the number of days in a year.
Mm-hmm.
It's the wine. I finished the whole can. I think that's 2 glasses. And then also, maybe you can join the awesome Facebook group Pets of Cunts, but you better answer those security questions before you even try it.
We don't let, if you don't enjoy kind of being called a cunt, you might not enjoy that one. That's not my favorite word in the world, but it's a little bit of a wordplay, and it's really fucking hilarious. But if you don't think it's fucking hilarious, I highly recommend you do not join. You would not have a good time.
Right. Agreed. All right. On that note, have a great day, everyone. I hope that you're just nailing everything in your life and speech and just being lovely. Bye-bye, everyone.
Yeah. Be lovely. Bye.